Chief Executive of the Murrumbidgee Local Health District. Good to go? Okay, well, good morning everybody. I'm here this morning with my colleagues from the Public Health Unit and Council and our Member of Parliament to give you an update on the COVID outbreak that's occurring here in the Albury-Wodonga region. Let me just start by saying that New South Wales Health is looking at this outbreak across both communities in Albury and also Wodonga, and we are really working in close collaboration with Albury-Wodonga Health, who unfortunately couldn't come and join us here today. The partnership between the two health organisations and working in a harmonised way across the border with the Victorian Health Department is very, very important. So today when we talk about numbers, we're talking about the New South Wales numbers, but every morning we get together with the Albury City Council and Police in a combined outbreak management approach between both governments. And I can only appreciate how difficult it is for people who live in a border town such as Albury-Wodonga Health, who are looking at getting slightly different messages from two jurisdictions, but we're working really hard to harmonise those messages as much as we possibly can, particularly from a public health perspective. And the New South Wales Government has allocated additional resources to come down and help during this outbreak, and we've got some additional resources in both our public health units, which is really fantastic, with senior epidemiologists and also some support with our contact tracing. So I'm just going to start with a little bit about the case numbers and the numbers for today, but I also urge people during this time to also look at the vaccination rates as we move away from an unvaccinated community into a community where we've got vaccination. I think it's really, really important that we look at the vaccination rates. So let's start there. Congratulations to Albury-Wodonga, and Albury, I'm going to report on from New South Wales Government perspective, is over 95% of citizens in this town are now vaccinated with their first dose, and that is fantastic to see, and leading the state, 83.3% are fully vaccinated. So that's really great news. In the outbreak numbers, so far we've seen 301 people on the New South Wales side of the border have caught COVID-19, and today we're reporting 40 new cases for the Albury LGA and 3 for the greater Hume area. But look, I think it's important to understand that during this outbreak we've had very little in the way of hospitalisation, and certainly Albury-Wodonga Health, who provide the clinical care for this community on both sides of the border, are doing a fantastic job providing clinical care, with the majority of the patients being cared for in the hospital, in the home. So great vaccination rates, low hospitalisation rates, but nevertheless we are dealing with a COVID outbreak, and the majority of the cases that we are seeing are under the age of 19 years. And of course that's having an impact also on families and schools, and we're working very hard with the Department of Education to again make sure that schools who are doing the contact tracing have got really clear messaging going out to their parents of their school community. We are urging schools at this time to really encourage parents to reduce things like birthday parties, sleepovers, and some of those indoor extracurricular activities where we can see spread. Also, we really want to have a Super Schools Week this week and really get those children aged between under 15 and over 12 vaccinated, because there are still relatively low rates in this LGA of children who are fully vaccinated. So we're also looking in New South Wales to support Albury-Wodonga Health in providing additional testing capability. So when we get schools sending out letters about people needing to stop and stay, just really want to encourage parents who receive a letter like that, please wait until you receive further advice from your school as to whether you require testing. We need to give our principals enough time to do their contact tracing and then get back to families with clear instruction. So be patient around testing, and only get tested if you have symptoms or you're advised by either our public health units on either side of the border or by your school to get tested, and that way we'll make sure that the right people are getting tested and we're getting test results back in a good way. We've also seen outbreak in aged care facilities in this region, and again our most vulnerable. people, our precious elderly people, and New South Wales works in very close contact under a protocol with the Australian government. And we're providing additional support in the way of infection control expertise, but the aged care facilities who have residents impacted are doing a great job and working very closely in contact with us and the Australian government. So that's the news update for this morning. I'm going to hand over now to Tracey Oakman, who's from our public health unit, to provide a little bit of further detail around some of the public health issues. Thank you.
Thanks, Jill. So, as Jill said, that most of the people who are diagnosed with COVID in this region are under the age of 19, and so that is taking up a lot of schools, kids at schools. So I'll reiterate what Jill just said about when a school gets notified that they're a case, they will send out a letter or information to parents to say stop and stay, to let us do or let them do a contact tracing event to find out where that either a child or a teacher may have come in contact with other students, and then they can send out more detailed information to those particular parents to let them know whether those children are close contacts or just casual contacts or nothing. And so that those parents will get that information, and then they can follow that guidance to go and get tested if they're close contacts. What we don't want is the entire school population going to a testing clinic or trying to get into our testing clinics when they in fact and don't need to get tested. They may not need to get tested, and what that does is it stops then people who are actually in need of getting tested getting a test, because there's too big a lines to get in that overwhelm the testing clinics. So please be patient, stay at home until you get that information from your schools as to whether you're a close contact or not, and then follow that guidance. That will go for other venues as well. When you hear, if you happen to work at a venue and you're advised that there's a case there, again, contact tracing will be done. If you're a close contact, you will be contacted by New South Wales Health, whether that be the Public Health Unit or the New South Wales Health Centre. So please be patient. I know everyone wants to know straight away, but lining up and getting a test sometimes can overwhelm the system and take away from the priority populations. Of course, if you're unwell and symptomatic, please do get a test. The other thing I wanted to talk a little bit about was the Service New South Wales alerts that came out from Thursday onto your phones. So if you've checked in on your Service New South Wales app, in the history section, if there was a venue identified where a case had been, an alert was put on those phones. That alert was not specific to the time you were there. It actually stated that if you click on the alert button, it will go into a message that says, if you were there, there was a case there on the day that you were there. So you may have been there at a different time. It also suggests that you just watch for symptoms. It doesn't tell you to go and get a test, just monitor for symptoms. So I understand that function has been suspended for a moment now because we have found that people were misunderstanding that message and were wanting more information, and so until the communication to the public has been able to get out to let them know that alert is just a monitor for symptoms alert. So just if you have seen that on your phone, please don't panic. As I said, you will be contacted if you're identified close contact, and otherwise just monitor for symptoms. That's it for me.
Yeah, good morning everyone. As we have been throughout this pandemic, we're here to support health in our emergency management arrangements as our other emergency management partners. In particular, police are concentrating on welfare and compliance, and we've actually secured ADF assistance with ADF members being on the ground here since Saturday, working with police, getting around particularly Albury and Gindra, and ensuring those people in quarantine have the welfare required. In addition, obviously, we are still looking at compliance with public health order requirements. Obviously, those public health order requirements have rolled back significantly from weeks and months ago, in particular not being in lockdown, but there obviously are still requirements. Mask wearing in certain environments, QR coding in, showing your vaccination record, etc. So we're certainly still working with business to ensure those environments are as safe as possible. Thank you.
Good morning everyone, Justin Clancy, member for Albury. I'm going to start with a shout out to our school students, to our mums and dads, to our teachers, principals, and to our businesses that are then impacted by cases going through our schools. I have made it clear from my end to Sydney that we need to move towards a clear, simple message going forward. People need to understand what is being asked of them. We cannot be having messages 8 days after exposure telling you to isolate and get tested. We can't have businesses, schools disrupted in such significant ways. I'm grateful for the response by Health. It's fantastic to have Jill and her team and the efforts of Murrumbidgee Health, to the team of Albury-Wodonga Health and their efforts, supported by agencies such as the police and Resilience New South Wales. It is so important that we have senior leaders from New South Wales Health and from Victoria Health here on the border, and it's very positive, pleasing that we are seeing collaboration that too often we are calling out for on the border. So to see that in action is fantastic, and I'm very grateful for that. But as I said, from my end, the call is going out to Sydney saying we need to have clear, simple messaging that our whole community can understand so that we can move forward together. Thank you. You can field the questions.
Field questions. Any questions? Inga.
Sunny's off.
Oh, you're very, very difficult to get on with. Just to reiterate Justin's messaging, I think from a community perspective, it's really encouraging to see the numbers for vaccinations increasing, but a crisis always brings us to the forefront. As I said the other day, this is not a drill, this is serious. The health authorities are really working well. At times, as the messaging has been a little bit disjointed because of the cross-border issues, but it reminds us how in the future we need to start working closer together with Albury-Wodonga Health. We need to get a seamless service where things like this won't be a problem. And we're all here, standing here together, saying the same thing. And I think that really is the important part about this. The community, if you don't need to be tested, don't be in the line. If it's not symptomatic and you haven't been notified to have a test, you don't need to get tested. I've had so many people feeling over the weekend on Messenger and all other platforms saying, I'm waiting in my car, and on Saturday there were no cars there. Everyone just decided Sunday was a beautiful sunny day, let's go and get tested. If you have no symptoms and you haven't been advised by the medical authorities to get tested, or the schools, don't. It's just a waste of time. I understand it's your right to do that, as I understand it's your right not to get vaccinated, but please be patient. Give the people that need to be tested the opportunity to get in the line and get tested. It's peace of mind, I understand, but for them it's more important. So as a council, we'll continue to support all the health organisations, and I believe right now we've got adequate testing facilities, and the resources that have been onboarded through the New South Wales Health, the ADF and through Murrumbidgee Local Health District are satisfactory right now to do the job. So let's not panic. Let's just get it done and let's get through this together, because as Justin's indicated, the government have been consulted upon what this impact looks like. They are very concerned about it. They are taking it seriously as they did in Sydney. Let's just get through it and let's do it together, because that's the only way we're going to beat this thing. And this is the new COVID normal. Once we get to 100%, what do we do then?
If the government is so concerned about the cases down here, why is it taking so long to get additional support? We've seen testing clinics, at capacity for days in a row now.
Yeah, look, I think again, the testing regimen hasn't been really clear in the communication. So people, whilst they're getting all that settled down, they don't, everyone, now we're getting a little bit more into the triage mode. It's not as obvious, and the schools understand what they can and can't do. The people who are in charge of health know what they can and can't do. So those two settings together, we're not talking to each other. Right now though, the schools are clear on what they have to do, notify the people they think are close contacts and get them tested. Everyone was just going in there, flooding the testing centres. Oh no, Albury's got infections, or Wodonga's got infections. It doesn't need to be like that. So I understand the confusion, I understand that complexity of two states with different messaging, but right now I think the testing and the hotspots and all that stuff have been put in a place where we understand what we need to do. Let's remind ourselves, I mean, these numbers are quite significant compared to other regional locations across New South Wales. So, and they're dealing with it really well and efficiently. And the message is 12 to 15-year-olds, let's get them done. And I understand parents' reluctance because there's been a lot of anti-vax messaging out there, but it's for their own safety and for the safety of others. So if they can get done, please consider it because it's important. And there's adequate stocks of Moderna and Pfizer out there for that to happen.
Any more questions? No. Maybe Jill?
Yeah.
Yep. Thank you.
Thanks.
Thank you. There you go.
We might just on that. Yeah, no, that's fine.
Sure.
Just on that issue that we're hearing people are getting tested unnecessarily, is there direct anecdotes of that? Because we've got 27 schools, so potentially 20,000 people needing to get tested throughout all of this. Are people actually flooding clinics?
Well, I think it's important. The message that we're giving out today is that people who need to get tested should either be symptomatic, even the slightest symptom, yes, we encourage you to come forward, or they've been advised by their public health unit or their school to be tested. And it will never occur that all of the schools will all have an outbreak at the same time. So what we're seeing is we're seeing contacts in schools and it's coming and going. I just wanted to reiterate though that right across all of the providers in Albury and Wodonga, Albury Wodonga Health, the Albury Wodonga Aboriginal Medical Centre, all of the private pathology providers are all providing additional capacity to be able to meet the needs of the people in the Albury Wodonga region. And we just need to make sure that we're getting the right people tested so we can get their results back early and get them into isolation should they have COVID-19.
On those testing, if a child is identified as a close contact at a school and needs to get a test, what's the requirements around their family and say other children that may live in their home? Is it just that child that needs to isolate and get a test, or is it the rest of the family as well?
Yes, so certainly, generally we say that a close contact and their household contacts should get tested. And then if they're all negative, then the child or the close contact will continue to need to isolate for a period of time. But the other people in the households will not, unless they are staying to look after the child. So whoever's staying home to look after the child, in the current recommendations in New South Wales, will stay in isolation with that child for that period of time.
Many parents, we're being told, are confused about whether their kids are classed as close contacts or casual contacts and what they should do when they're waiting for that information. Can you please advise, just in a nutshell, what a child needs to do if they're casual versus whether they're a close contact?
Yeah, certainly. So first of all, let me say that the parents will be very clearly, will have that information sent to them very clearly in a letter from the Education Department or the Private Schools Department, from their principals. They will get that letter and it will say your child is a close contact, your child is a casual contact, or you're at the school, there's a case there and you're neither. You just don't have to worry about it. So the parents just need to wait until that information is available from the school. And that will take probably a day maybe for the school to do that risk assessment and make that analysis. So that's the first step. So if someone is a close contact, they do need testing. They need to be tested and isolate. If someone is a casual contact, they will need to be tested, but then they do not need to isolate if they are negative. So the letter that the parents will get very clearly spells all that out to them.
And what's happening to make schools safer right now? Because we've got under 12s and who can't get vaccinated. We're going to keep seeing cases until they can. How are we going to make schools safe for for students?
Yeah, look, there's been lots of strategies put in place from the education department and the private schools to encourage schools to act in a COVID-safe way. That's been going on since the schools were allowed to reopen. And some of that is, and every school will take a different approach, and the principals of those schools will be guided by what they know is best on the local grounds. But some things are like separating the years, so one year doesn't mix with another year in the cohort. Separating where the kids might have lunch, so that children do not intermingle between years, for example. So that was a really good strategy that worked really well in a school that we had an outbreak in a different time. So we were able to minimise the number of children that were identified as close contacts because the schools only let that one particular year stay together. So every school is different, and it depends on how the classes go and so forth. Also, obviously, indoor activities around exercise classes, singing, shouldn't, choirs, that sort of stuff is not recommended at the moment. So schools can implement a whole range of strategies such as that, which should COVID come into their school, and will minimise the number of contacts that have to occur.
Just on that, are there, I guess, any plans to put all the schools in the area back to remote learning just for, say, the next 2 weeks until the cases do die down a little bit?
Look, that is certainly not a decision for me to make, but at the moment, no, that is not a decision that is going to occur. We are, as Jill mentioned, we're encouraging, there's lots of education going on to the parents from the schools and from the education department to make the children, or to stop the children intermingling outside of school as well, to minimise their activities where they might go, no parties, no that sort of thing, as Jill mentioned, to try and minimise the risks of a child catching COVID and bringing it back to the school. So that's the strategies that have been implemented at the moment, and Super Vaccination Week this week, where we're trying to get all the kids vaccinated, so, that is eligible, of course.
Despite the measures that you've just mentioned, obviously there are parents in the area that will be nervous to send their children back to school, especially primary school parents where kids can't get vaccinated. Do you have any words of reassurance for those parents?
Look, we are in a new environment. We're in a COVID world. COVID is going to be around for a long time. I will make sure the parents, words to the parents are, make sure all the adults in your children's circle of relationships and friendship and contact are vaccinated, and that gives the child the best protection they can have. So that's what we have at the moment, the vaccination rate. So if everyone that's eligible can be vaccinated, that gives those children the best protection.
We obviously had contact tracers, employed to do the work of that and of the health background. We're now relying on teachers and principals to do this sort of work. How equipped are they to be doing that sort of contact tracing?
That's a really good question. So you're right. So the teachers, the schools under the legislation now have the powers for contact tracing, and there's education tools around risk assessment documents that helps the principals and those at the schools go through guidelines on what's identified as a close contact or not. They're very specific. They're very similar tools that we use in our hospitals and our other exposure sites as well. The education department and the principal and the independent schools are also very aware of what to do, and they support those local schools as well. So there's a lot of supports for the schools in going through that risk assessment.
Could it be a matter, I know we're seeing high testing rates at the moment, but could it be a matter of some schools just looking at it and being like, well, they're on the side of caution and this whole cohort needs to get tested?
The schools are never left to their own devices. They're always supported by the experienced, either Ministry if they're public schools or the independent schools as well. So I doubt that would happen. I believe that they will be enabled to make a good judgment of close and casual contacts within the school.
We're about to see tourism restart. How are our testing centres going to cope, and can we get maybe ADF assistance in that sense if they're helping with other operations?
Look, I think that our testing centres at the moment are adequate, and across the district, we have different surge strategies in place for where we need to set up more testing clinics because Albury, while we have the outbreak here, of course, there is going to be more cases that occur across New South Wales. The more and more we open up, the more we have travel, and the strategy is for us all to get vaccinated so that we do minimise the impact of the COVID cases in our hospitals. But the testing clinics, look, at the moment I believe they are adequate. They're struggling at the moment, of course, with the huge numbers linked to the people who come up from the schools in particular, but generally we have adequate testing.
What are those meetings that you're having between both governments telling you? Is a 10-bed ward at the cancer centre going to be enough? What do we need to do? Are we expecting there might be hospitalisation of people?
Yeah, look, I'm afraid I don't have information specific to that. I do understand and probably Jill is the best person to talk to about our hospitals and our preparation.
Thank you, Tracey. And look, I think that question is best put to Albury-Wodonga Health, given it's their jurisdiction in terms of clinical care provision. But we're working very closely in terms of the capability of the health system to be able to respond, and certainly reaching out to Albury-Wodonga Health to offer them additional capacity. The majority of our patients, as I said before, are being cared for in a hospital in the home, and that still means though that they still need to have that clinical care, but also there's the welfare component when you have somebody in isolation. There are quite significant issues around being in isolation for 14 days, and the welfare support from Resilience New South Wales and some of the non-government organisations in this region around food provision, medications, food for the dog, those sorts of things are really important. And given 2/3 of our cases are so young, they're not actually getting really sick, and that's terrific. And I think Albury-Wodonga Health confirmed to me today they haven't had any children admitted to their hospital so far with COVID-19, which is really great news. But we are also, New South Wales Health is also providing what we call a Medi Hotel here in the region, where people who don't have a suitable environment to isolate at home are supported in a hotel-like environment with both that welfare support, mental health, drug and alcohol, and also with their clinical care. And Murrumbidgee Local Health District is providing that clinical care for those small number of people. We're also providing what we call community supported accommodation, which is for people who might have limited capacity, who are close contacts, to isolate at home in special circumstances. We'll also arrange accommodation for those people as well.
Do you have an age breakdown of the cases from today? I guess, you know, you've said a large portion of them are under 19, but do you have that sort of breakdown?
Not today's data.
Not yet, but certainly as that epidemiology curve is looked at, we'll certainly make that available to people so they can have a look. Yep.
Sorry.
There you go.
Albury-Wodonga Health told us yesterday that their modelling predicts a peak in cases in the next few weeks, followed by a potential second peak in December and January. Is that what you're expecting to see as well? Is that what your modelling predicts?
Yeah, so look, that's fairly consistent with the sort of work that we are seeing as well. But it is, again, as I reiterated earlier, really important that we have a look at both communities from both sides of the river. And obviously that Victorian data, as we talked about earlier, is now being shared between the two states so that we can get a better picture of the modelling from both sides of the state. Yep.
What's the information sharing been like with the contact tracing when you're having conversations with, you know, these 200 Albury people who are COVID positive? Do you check Service Victoria? Can we rule out any unnecessary spread through double handling?
And look, I can hand over to Tracey Oakman because she talks to her public health unit counterparts that are really just down the road every day. So I'll let Tracey comment on that.
Yeah, thank you for that. So yes, I daily I'm in contact with the public health unit. So we do share information so that we can try and pick up any of those clustering and the risks. So yeah.
I can see Paul's maybe ducking away, but just a quick question on Adf Support. I was just wondering what sort of support they're giving to the community in terms of delivering food or what's happening.
Yeah, as I said, from Saturday we've had some ADF personnel here working with our police, so working hand in hand with our police, bolstering our numbers and our capability to get right around the Albury and Gindera populations. Welfare, we pretty much turn up at the doorstep of someone isolating, check they're okay, check their needs, and if there is need for that sort of support with food, hampers, etc., we've got support through emergency management arrangements with Resilience and other agencies, and we make that happen. So at the moment, ADF are really essentially doubling our numbers to be able to get right around those people in the short term, and they've been doing that work now for a number of weeks in and around the Illawarra and Sydney, of course, and as the issue has grown here, they've moved their resourcing to us.
How many are there, and I guess how long are you expecting them to be here for?
I've got 9 in this crew here, and put that with 9 police, it's a good number. They're here for at least a week, and we'll obviously just have to gauge as things progress.
What sort of warnings or fines have you handed out throughout this outbreak?
Oh, listen, let's just talk in recent times, and don't wind it back too far, as we've been going for a long time. People have been pretty compliant, and again, I must say, obviously the public health order has reduced, so obviously the fines have reduced because the breaches are less. However, we have had still some blatant disregard right across the police district that we've dealt with. Our calls for assistance from business about compliance with the not only check-in but the double vax has reduced, which is great to see. Those businesses not getting a harder time as they initially did. And generally speaking, our compliance with those who are under self-isolation orders has been very good too.
Are you expecting that to stay the same as we open up? 1st of November is when Sydney-siders and metropolitan Melbourne people can come across the border?
Well, that's right, but we've got to accept the fact is the public health order will allow that. Whereas before we're doing checkpoints on the freeway, etc. Well, that'll be a thing of the past because the public health order will no longer prohibit it.
I have a question for Justin.
Yeah.
Can I? Well, Inga, I was just going. If I just revisit a couple of questions there, please. I just want to say the question about for parents and students returning to school. I think it's fair and reasonable to have those concerns and to have. I think it's fair and reasonable that sense of anxiousness. But what I would encourage is, please be reaching out and talking directly to your class teacher. Please be reaching out and talking to your school principal. They will be able to assure you. They will be able to walk with you and work with you in terms of education for you as a student or for your child as a parent. So I think that's a message to say, reach out, talk to your class and principal. In terms of the contact tracing within schools as well, this has been approached by New South Wales for some time now. The important message there in that regard is who better in terms of knowing the interactions of a student than the teachers of the school. They, given the support by health and Department of Education, they'll know your child, they'll know their interactions. That is an important means of contact tracing in that regard.
Just on schools, we've heard a lot of people are just flat out refusing to send their kids to school at the moment while there's an outbreak and schools are closing. Are you concerned at all, I guess, for the progress of students learning? Obviously we've been through the pandemic and home learning and whatnot, but now if people are refusing to send their kids to school?
As just said, I can understand that concern. I think that is a concern that is a fair concern for a parent to hold in terms of for their child and also for school students themselves. But as I said, please reach out to your teachers, reach out to your principal, let them reassure you about the process that school is going through. Please make sure that at the end of the day, we're taking the right steps, not just from a health perspective, but also for education of your child.
Justin, in terms of testing resources, I know that today a lot of people here have said that our resources are adequate. I'm sure people sitting in testing lines probably think differently. Do you have any plans to ask for more resources in Sydney if these testing lines do persist and people don't kind of back off from that reassurance of getting tested?
Yeah, I've been quite clear in demands for Sydney for the additional resourcing, and again, I'm thankful for the resourcing that Murrumbidgee has put into our Albury community. I will say in that regard, part of it is also the flow. There will be a set number of people within those testing clinics doing the testing each day. If everyone turns up at 8:30 in the morning, you are going to see peaks. We're then finding that later on in the day that there is much less traffic coming through. So please be mindful of that. Please be, keep that in your consideration. If you are going to get tested, maybe give consideration as the time that you are turning up to the clinic, and reiterating the message there before, please be testing if you're symptomatic or if you've been asked to do so by the public health unit.
Speaking to one mother today, her child was one of the first to get their first vaccination. Obviously that only opened for 12 to 15s in September. Do you understand why people are feeling like kids are being left behind here, being that they're so late in that vaccination program? Have we opened up too soon for them?
This is, we've seen the virus move from older age groups into the younger age groups. Obviously, the vaccination needed to go to what was considered vulnerable categories at the time, and that was the importance of vaccinating the older community in that regard. As you said, it's been there since September. I know that people, that's a matter of getting appointments. I'm pleased to see the pop-up clinics this week, and clinics will continue to work with Murrumbidgee in this regard to see clinics go out directly to our high schools, because we want to make sure the opportunity is there. You only need the 3 weeks. Don't wait longer. Wait your 3 weeks for your Pfizer or your Moderna. Get your second jab.
Is there any plans currently in place in terms of exams if we still are seeing these sorts of exposures and closures and whatnot, in terms of a Year 12 student sitting in exam and isolation? And do we have any news on that, or what will happen?
Yeah, I won't speak for the Education Department. I would expect that they have contingencies in place. I'll certainly make sure that I'll be following up with them to explore that is the case.
Just had a couple final questions on vulnerable groups.
Yep, okay. We'll have to wind this up soon.
Yeah, we do.
Yeah, no problem. Just Mercy Place, is that outbreak considered under control, and what are you doing to investigate the source of that outbreak?
Yeah, look, the Mercy Place outbreak is undergoing ongoing monitoring. So we haven't had we haven't had any new cases in the last 24 hours. So that's positive. But we will continue to test and monitor the residents there and the staff there for a period of time before we believe that there can be no further cases. So it's an ongoing thing. We'll go over a period of a few weeks just to ensure that there'll be no more people incubating it and bringing it in, or staff with the conditions. So as I said, the staff are being tested every day before they go to work with the rapid testing that they have, and residents will continue to be monitored.
And you're confident that your communications with Clyde communities are good? There's a lot of non-English speaking people now.
Yeah, look, I mean, that's always a challenge, and we're doing our best there. We have 3 interpreters who have flown down from Sydney to support our response to the cold community, and they are going out to the testing clinics and the vaccination clinics and the home visiting that we're doing. So we are doing as much as we can, and look, I think they're feeling much more supported in the last week than they have been, so yes, that's positive.
Do you think we've moved past the point of focusing on case numbers alone and looking at sort of hospitalisation rates instead? Like, do you think we should be alarmed when there's, say, X amount of cases, or is it more accurate to worry about the percentage in hospital?
Look, I think as we're moving into a fully vaccinated population, we will be more concerned about the hospitalisation rates, because people who have COVID, who are vaccinated, which can happen, will be less concerned. It'll be a mild illness, and we won't be worried about them so much. So it will evolve into a hospitalisation data, I believe, but currently we're not quite there.
Just a couple of questions for Wagga as well. What are the latest vaccination rates in Wagga? Do you know?
Not off the top of my head, sorry. Do you know the vaccination rate off the top of your head?
No, look, they're on the Australian government website.
Yeah, you'll have to.
And is there any update on the source of that Wagga case?
Oh, I'm sorry, I was trying to think of the game. Yeah, we believe there was an Albury link. Yeah. Okay, thank you. Well, we have to finish now. Thank you very much, everyone.
Thank you. About ventilation in schools and what I guess Victoria has a system in place. Is there anything happening in New South Wales in terms of ventilation to make the classrooms safer?
Fundamentally, what is critical when it comes to classrooms is fresh air movements and ventilation. Can say that for any population density in a confined space. So you need to be looking at fresh air movements into those classrooms, having a machine in the corner of that room that requires filter changes, that needs specific filters that are less than 1 micron diameter filter to be able to capture viral particles, needs regular servicing, and I've seen that sort of equipment break down, is only going to play one part of what is fundamentally